roads.
BBC Radio Humberside.
Right, morning. It's me, your friendly neighbourhood smile maker, Coffee Smiles. And yes, the election is just around the corner. Yesterday was the last day for you to register to be on the electoral roll. So did you get it in? Did you do it? So for those of you who did, and those of you who are maybe sort of like, I'm registered, but I'm not sure who I'm going to vote for. I'm not sure if even I'm going to vote, but I've registered because I know it's a good thing. What do you want to hear from your politicians when it comes to the general election? What's actually going to help you decide on how you're going to cast your vote? Now, we've been sharing people's stories as to what matters to them, what matters to their family, their friends, their local community. You know, they've been telling us about what politicians need to do in order to get their vote on the 4th of July. Now, the Conservatives, you know, the Labour Party, Greens, Lib Dems, Reform UK, all their manifestos are out, so you can have the chance to go and have a look at them, giving you the chance to see what the political parties are promising you this general election. And this Friday, we're going to hear from some of the local candidates with our own election debate on Radio Humberside from about 11 o'clock. So what are the most important issues for you? What do you want the next government to focus on? Nikki lives in Headon. Let's hear from her.
My husband, Scott, is classed as immunocompromised. He was diagnosed with mantle cell lymphoma back in 2021, had various chemotherapy treatments and stem cell transplant in November of 2021, recovered really, really well. But because of the immunosuppression he has to take to keep the cancer at bay, he has no protection from COVID. So couldn't resume back into normal life, couldn't go back to work. I had to shield with him. So luckily for me, I work from home, but there's lots of patients out there like my husband who don't have a response to the COVID vaccine and they need protection. Lots of people really desperate, still shielding 4 years on. You know, for most people, the pandemic is over, but for a lot of this group, it isn't. So people are still shielding and still at higher threat from COVID. And because of the conditions that they have, if they do catch COVID, it can be really bad. They can have a lot worse outcomes than normal people. There is a drug that can help. A drug called Evershed. They're now actually working on the second version of this, but we were very, very fortunate to be able to access it privately. So our life has resumed, but, you know, for most people, this is not achievable.
So is that what you would like to see pledged then from the politicians ahead of the general election and then carried out by whoever the next government is?
I would. Well, I would like to see them prioritise the COVID medication treatments. Evershed is one of a few drugs that are available. It was looked at by the previous government, but it was put down a protracted route of the NICE appraisal, which is not necessarily fit for purpose because by the time they've assessed the drug, it's like the COVID vaccines. They're not efficacious against the latest variant of the vaccine. So it's something that needs to be on a fast access approval process. The other thing is that there's no means of support for most immunocompromised people either. So many are having to shield, which means they're unable to work, but they've got no financial support either. So, the whole situation needs to be looked at.
Now, on their website, the Department of Health and Social Care say, based on the evidence available and after careful analysis and consideration, the UK government decided not to procure Evershed for prevention through emergency routes. You can actually